สวัสดีครับ Rise and Shine and welcome to the morning edition of NBT World Brief. I'm Surabhalaw Tharanarit. Prime Minister Anutin Chanvirakul and his economic team visited Hat Yai to assess flood damage, meet local business operators, and outline the government's relief and recovery measures. Prime Minister Anutin led a team of economic ministers to inspect Hat Yai, saying it is best that they see the conditions for themselves. Afterwards, the Prime Minister chaired a meeting with Songkhla's business community, the Provincial Chamber of Commerce, and private sector representatives. He said there are things the government might have overlooked since they are not locals, and that the suggestions from the meeting were very useful. He said the government is now fully focused on the recovery phase and restoring all utilities so people can return to their homes as soon as possible.
ประชุมกันตั้งเกือบ3 ชั่วโมงนะครับได้เนื้อหาเยอะมากแต่ว่าสิ่งที่เรามุ่งเน้นก็คือคืนชีวิตนะครับคืนความเป็นปกติสุขให้กับพี่น้องประชาชนชาวสงขลาจังหวัดหาดใหญ่แล้วก็จะหมายถึงรวมไปถึงพื้นที่ประสบภัยอื่นๆด้วยนะครับผมบอกทางท่านนายกอบจ.ซึ่งเป็นเพื่อนผมด้วยนะครับว่า7 วันพี่น้องประชาชนต้องกลับบ้าน14 วันหาดใหญ่ต้องสะอาดนั่นคือเป้าหมาย
The cabinet recently approved compensation of 9,000 baht per affected household, and Songkhla province has already registered 520,000 applications. Payment disbursement is being expedited. The Prime Minister also clarified that rental households will receive the relief payment based on utility records, while repair funds will go to property owners. In the evening, the Prime Minister and Lieutenant General Noratip Poinok, commander of the 4th Army Region, visited Hat Yai Hospital to inspect cleanup operations. The Prime Minister thanked the military personnel for their hard work and offered words of encouragement to everyone involved. Earlier in the day, the Prime Minister had visited flood-hit areas of Hat Yai, observing heavy damage as residents cleaned their homes and shops. Streets were lined with piles of debris, damaged furniture, and belongings waiting to be collected by municipal workers. He also stopped at Kok Samanakun Temple, where he handed out food, drinking water, and medicine to residents. The Prime Minister also spoke with affected families, explaining the government's lending measures, up to 100,000 baht interest-free for 6 months to 1 year. Hat Yai Hospital is reopening its emergency department today after days of severe flooding, but services will resume at only partial capacity as the facility continues to recover from extensive damage. Hat Yai Hospital will resume emergency services today at approximately 60 to 70% capacity. The partial reopening aims to ease the difficulties faced by local residents who are ill or injured. Director of Hat Yai Hospital, Dr. Wirod Yommuang, expressed profound gratitude for His Majesty the King's gracious support after the King granted 100 million baht to help the hospital restore its operations and return to full service.
พระราชทรัพย์ที่ทรงพระราชทานมาให้พวกเราก็จะเอามาใช้เพื่อการปรับปรุงอาคารสถานที่ที่ได้รับความเสียหายโดยเฉพาะตัวแผนกอุบัติเหตุฉุกเฉินและก็แผนกผู้ป่วยนอกซึ่งมีพี่น้องประชาชนเข้ามาใช้บริการเป็นจำนวนมากจากการประเมินความเสียหายเบื้องต้นนะครับน่าจะอยู่ราวๆที่ประมาณสัก 1,000 ล้านบาทด้วยเหตุว่าระดับน้ำที่สูงถึง3 เมตรอุปกรณ์เครื่องไม้เครื่องมือโครงสร้างทั้งหลายในชั้น1ก็เสียหายแทบจะทั้งหมดรวมทั้งหน่วยงานระบบงานสนับสนุนไม่ว่าจะเป็นไฟฟ้าประปาระบบการจัดการของเสียแล้วก็ลิฟต์ขนส่งระบบสำรองพลังงานเครื่องกำเนิดไฟฟ้าทั้งหลายก็แทบจะสูญเสียทั้งหมดครับ
Dr. Wirod said that despite the flooding, the hospital never fully suspended services, but continued providing care to the best of its ability throughout the crisis, both in the emergency room and in inpatient care. The hospital is now able to treat yellow and green-coded patients. while red-coded critical patients will continue to be transferred to nearby hospitals with greater capacity. The Thai telecom regulator has ordered all mobile operators to provide free calls and internet to people affected by severe flooding in the south, as communication networks continue to recover in submerged areas. The National Broadcasting and Telecommunications Commission, or NBTC, has expanded its emergency relief measures, directing all mobile operators to waive charges for voice calls, mobile data, and Wi-Fi services for residents in flood-hit districts of Hat Yai. The regulator and major mobile operators, AIS, True, and NT, have been stationed in Hat Yai since November 25th to help restore damaged communication systems. Satellite operator Thaicom has also been brought in to install satellite internet at hospitals, evacuation centers, and field medical units, ensuring doctors, nurses, and frontline responders can communicate and continue essential work despite power outages that crippled local networks. As of now, about 85% of communication services in Hat Yai have been restored, following gradual power resumption by the Provincial Electricity Authority. The Disaster Prevention Department reports over 3.9 million people affected by severe flooding across 9 southern provinces, as the northeast monsoon continues to impact the Gulf of Thailand and the Andaman Sea. The Disaster Prevention and Mitigation Department says the intensifying northeast monsoon over the Gulf of Thailand, the South, and the Andaman Sea has strengthened wind and wave conditions, triggering heavy to very heavy rain across many southern areas between November 17th and today. So far, over 1.5 million households, or more than 3.9 million people, have been affected. Flooding remains in 9 provinces, namely Surat Thani, Nakhon Si Thammarat, Trang, Pathalung, Satun, Songkhla, Pattani, Yala, and Narathiwat. A total of 170 deaths have been reported in 8 provinces: Nakhon Si Thammarat, Trang, Pattani, Yala, Pathalung, Satun, Narathiwat, and Songkhla, where the highest fatality has been reported. By the end of today, southern Thailand is expected to see lighter rain as the northeast monsoon weakens. Waves in the Gulf of Thailand are forecast to reach 1 to 2 meters and over 2 meters in areas with thunderstorms. Authorities are urging all vessels in the Gulf of Thailand and the Andaman Sea to navigate with caution and to avoid sailing in stormy conditions. Meanwhile, flooding persists across 11 provinces in the lower northern and central regions, affecting hundreds of thousands of residents. Authorities report that almost 140,000 households, or around 486,000 people, have been impacted by flash floods and river overflows in Pisanulok, Nakhon Sawan, Uthai Thani, Singhburi, Chainat, Ang Thong, Suphanburi, Ayutthaya, Pathum Thani, Nonthaburi, and Nakhon Pathom. A total of 28 deaths have been confirmed, with the highest toll in Ayutthaya. Officials note that water levels are gradually receding across all affected areas. As floodwaters in Hat Yai begin to recede, mental health experts warn that stress levels remain critical, with many survivors experiencing guilt for having survived while others suffered. Experts from Thammasat University warn that immediate mental health support is essential, particularly for those showing signs of shock, depression, or survivor's guilt. Volunteers and frontline responders are urged to identify at-risk individuals and coordinate with local social services and medical teams for urgent counseling. High-risk groups include those awaiting aid, vulnerable populations such as the elderly or disabled, and residents in temporary shelters. Researchers also caution that constant exposure to news coverage can intensify survivors' guilt, making people feel responsible for those who did not survive. Thammasat University recommends mindful media consumption and channeling empathy into practical support, like distributing aid packages and assisting hospitals. Meanwhile, the Department of Mental Health has deployed 6 MCAT, or the Mental Health Crisis Assessment and Treatment Teams, since last week to assist communities affected by severe flooding. They'll work alongside emergency medical units. Their mission is to provide emotional support, psychological first aid, and stress management guidance, especially within evacuation centers. And that is it for our morning edition of NBT World Brief. You can stay updated with the latest developments and more stories by scanning the QR code on your screen to access our full coverage across all media platforms. Until next time, สวัสดีครับ